Good afternoon, ladies and gentlemen. So wonderful to see you all for this very exciting panel discussion. We're now going to be addressing AI in the clinic, how MED42 LLM is shaping physician practice. To take us through this, and actually to take us through the next 3 sessions, I'm going to be inviting on stage expert moderator and expert speaker, and now a friend from M42, Dr. Maz Sheikh, VP Product Management, M42. Give him a big round of applause.
Thank you. Good afternoon, everyone.
I feel like, Dr. Maz, you and I are co-hosts for the next 3 sessions.
Thank you. My pleasure.
Let's, between us, introduce our guests. So I'm going to start with Professor Dr. Laith El-Rabai, consultant gastroenterologist and hepatologist at HealthPoint. Please do join us on stage.
I think I'm going
Dr. Maz, if you'd like to introduce the next person.
We've got Professor Dr. Jonathan Conroy,
So if you could just take that.
consultant orthopedic surgeon at HealthPoint.
Fantastic. So Professor Dr. Jonathan, you are under the right seat. And then our final panelist is a good friend of the stage with us as well.
Dr. Andrew Jaremjiko, consultant occupational health at HealthPoint.
Fantastic. It's always wonderful to have our moderator to be part of the introduction as well. You know these gentlemen really well.
Definitely.
Dr. Mars, I hand over to your very expert hands. Please give our panelists a big round of applause as we begin today.
Thank you. Thank you. You would have heard about MED42, our clinical large language model-based question answering system that we've implemented at some of our hospitals. We've got an astute panel today who would be helping us understand the impact of using MED42 and their experiences of using MED42 in their clinical practice and how it's have been impacting their practice and them as an individual. So we've got 3 different doctors, very different specialties. Dr. John is a surgeon, Dr. Laz is a gastroenterologist, and Dr. Andrew is an occupational health specialist, very different ways of practicing. So we'd like to ask each one of them to share some of the challenges that they face in their clinical practice and how MED42, how they've applied MED42 to those challenges and what's its impact been. Starting with Dr. Jonathan.
Thank you, Maz. Well, I'm an orthopedic surgeon, and we love technology, and we love toys, and we like playing with things. And I've been so excited to get this technology in my clinic. The MED42 app has really changed my practice in interacting with patients. Most patients come to a clinic and they want to see their surgeon, they want to see their doctor, they want to make a relationship with you. But from the doctor's side, we have limited time. We've also got to get through a lot of information and get that information over to the patient. We have to make sure that they understand what we're saying, that they have the opportunity to ask all the correct questions. And sometimes these discussions, that can be quite complex. So I found that in my clinic, quite often, I don't feel I've had enough time to concentrate on the patient and the specific questions that are important. And with this app, it's enabled me to spend more time interacting with the patient. The documentation is done automatically in the right order that I want it to be. And I'm able to, if a patient has a specific unusual operation they require that may have risks associated with the fact of their diabetes or other conditions, I can get real up-to-date peer-reviewed data immediately from the app. And I can put all the information in and it gives an immediate answer. I can go through it with the patient. I can send a copy via email to them so they can read and look about it in more detail. And that just allows me to make sure at the end of my consultation I've given them everything that they want and given up-to-date peer-reviewed information. Thanks, Mike.
Thank you, Dr. John. Dr. Lath.
Thank you very much, Dr. Maaz, and thanks for the audience. It's an honor to be here and share the platform with my esteemed colleagues. I completely agree with Professor Conroy that this MED42 has changed the way we practice medicine, and I think it will transform the way we deliver healthcare in future. I am like the orthopedics. We do like toys and gadgets. We use endoscopy. So when I got my first look at MED42, I said, wow, this is what we need. And before MED42, there are some historical challenges. So traditionally, healthcare service relied on paper-based records. Although we have electronic medical records, but they are basically designed for medical billing. They're not designed to support physicians in making decisions or providing information. And trying to stay up to date, like Dr. Koroy said, with the up-to-date evidence-based knowledge, literature search is very challenging. You have very limited time in the clinic. So this traditional approach in dealing with patients and getting information has led to administrative burden. We don't have time. And because of this burden in the clinic, this has affected the face time we spend with our patients. This very face time that we are fundamentally learned or told to do it in the medical school. But this is all history now because we have MED42. So MED42 has changed the way we interact with patients. It allows me rapid access to reliable, scientific, evidence-based knowledge that I can immediately apply in my medical practice, giving me more time to reflect and interact with my patients.
Thank you, Dr. Led. Dr. Andrew, please.
Yeah, thanks. MED42 has really become my friend. I actually talk to it. I sort of say, oh God, I hope you're good today because I'm not feeling the best. Really, I get very complicated patients, say firefighters. You know, they might have been to a fire, they're feeling fatigued. They may have been exposed to 100 chemicals, maybe even with all the plastics and everything that it's burning in houses today. Honestly, they get multiple exposures. I got a list once of 200 chemicals, and I meant to go through that in 40 minutes and still talk to the patient. You know, it's an almost impossible task, and there's some days where I just feel really stressed because 40 minutes is just not enough time. But with MED42, honestly, I can actually now very quickly pick out the ones that are dangerous. You've got things like MSDSs, safety data sheets. You have to go through all these things, try and work out which chemical is the one that might be causing these symptoms. And it's actually very complex. And without support, I was really, really stressed. So that's why it's almost become my friend. I mean, I'm almost having a relationship with it. I'm saying, oh, I didn't know about that. That's great. And it doesn't talk back yet, but I won't be surprised if one day it yells at me and says, hey, wake up. You forgot about asking this question. So I'm looking forward to that. But really, it has made a difference, and it's helping me restore the human touch between me and the patient. And that's what's really important, being able to talk to patients again, because I actually like talking.
Thank you, Dr. Andrew. So these are great points. You know, it's been a companion, and it's been a guide, it's been a friend. But everything is incomplete, and there's always some scope for improvement. So my next question would be, if there was one superpower that you would wish for in MED42, what would that be and why?
That's a really hard question, Mads, and you're good at asking hard questions. But I thought I would say, in my practice, one of the areas I could really see improvement and help is some of my patients come back, for instance, after a total knee replacement, and they come back for routine assessment. And those routine assessments, they don't necessarily have to be by myself. And I would like to see the day where a patient can come in, and I would assume the patient's happy with their progress. They can speak to the app. It can ask specific questions that I've pre-programmed. It can check that the patient doesn't have a temperature. We can put a mobile phone or a camera to the wound, and it will say that the wound's healthy. It can interpret the post-operative X-ray and check that there's no problems with the X-ray. It can take. We like to have post-operative or a scoring technique where we can work out how a patient is doing compared to a national average, PROMS scoring. And it could work out the PROMS, and it could work out whether this patient is making progress compared to the same group with age, sex, everything. If there's any problems, it can highlight to me, and I can go and see the patient. And even if I do see every patient, it would be limited time. And I think that would be really useful. And with new technologies in implant design, we already have implants now that have monitoring devices within the implant. or we can use other implant techniques such as Biosense, which can also link into the app and give us even more information. And I would love the day where I go in and see my patient, talk to them about their hobbies or something, and have all the information. I know that patient's doing very well. That's one superpower. I've got about 100 others.
Wow, that's brilliant. And Dr. Ladd, how would you like to transform gastroenterology with this?
I wish I have the superpower, Dr. Maaz, but if I have, I'm excited. I'm so excited about MED42. I think the future is now, and the MED42 will change the way we deal with and interact with our patients. If I had a wish, I would wish the superpower of MED42 to work on two main areas. First of all, precision medicine, and second, global health. So when we talk about precision medicine, MED42 has the ability to analyze a vast amount of information using genetics, environmental factors, and lifestyle. And this will help us to have a decision, support our decision making, to have a tailored medical treatment individualized to each patient. This is amazing. At the moment, we treat all patients the same, but we know for a fact people are different. Their microbiome different, their genetics are different, their lifestyle different, the environmental exposures are different. I had a patient, for example, who lived in a place where he was exposed to chemicals when he was young, and he came because he worried about cancer. I mean, these people has to be screened earlier than the rest of the population. And MED42, the way I see it, will help us to pick up those patients to provide them with a treatment which is different from the rest of the population. The other area I think too, in terms of precision medicine, is have preventative or predictive model, because MED42 will be able to look and examine medical information and biomedical information, such as Dr. Conroy said, the information that we get from their plant. And this will develop sort of precision preventative medicine to prevent the disease from progression rather than waiting for the disease to develop. So we're MED42 not only seeing things that we can see, but also MED42 will be able to see things that we cannot see and stop it from happening. The other thing which I'm very passionate about it, because I worked with many charities across the world, I think MED42 will provide equity in global health and care services. Let us just imagine a world, a decade from now, where people or doctors from low and middle income countries have access to this open resources, this free platform. They will be able to access the state-of-the-art medical knowledge, will apply it to their patients. This was not possible before MED42. Now it's possible. It's all been validated and evidence-based. This will accelerate the dissemination of medical knowledge even to a remote rural countries or places which we would never think about having this in the past. So it's amazing, and I completely with it.
Thank you, Dr. Ladd. Precision medicine for the world at scale is a very, big superpower. Thank you. Dr. Andrew.
Yeah, I was at a firefighters conference, and they were saying that the alarms in buildings, they always go off, and they're false alarms. And they said, the firefighters said, we need an alarm that's like a human person, that can see what's happening, that can hear what's happening, that can feel what's happening, and so we don't get called out to false fires all the time. And I feel that's the same with this app, and it's almost there. I mean, we're doing chest X-rays through artificial intelligence, so it's got eyes. It can look at X-rays and see things that I don't see. Its language is great. I mean, it can speak Arabic a lot better than me. It actually does both Arabic and English, which is useful for me. And it can actually obviously get the latest scientific literature. I mean, it really is getting more and more human-like, and that's why I say I'm almost talking to it. But I think of there was a movie called Big Hero 6, and the superpower there was superhero. He said, flying makes me a better healthcare provider. And I just want to say, yes, speed is really important, because that's what this has made the difference. It's actually made me faster. That gives me more time to the doctor. And to be honest, it does already fly. I would take 2 hours to write a report. These reports come out in 5 seconds. So it is amazing. So keep up the flying. But if you want to give me some boots as well, that'd be great. And if you want to do autopilot every now and then.
For sure, Dr. Andrew. And why drive if you can fly, right? So we've got the powers here. Thank you so much for your time, doctors, from getting time from your busy schedule. I think we've finished before our schedule over here. Of course.
Just because I'm so excited by this, I want to give an example in knee replacement, for instance. So I was on the National Joint Registry in the UK, and for 20 years or so, we've been collecting data on knee replacement, so type of knee replacement, age, also male, female, the type of disease, so rheumatoid or osteoarthritis. We have over 1 million cases that's in that joint registry. It's the biggest in the world. So we can go to an app like this, we can access the joint registry data, and we can say, if I have a patient who's a male, who's got avascular necrosis of the hip, and they're age 40, it will give you the information of what type of implant has the greatest longevity for that age group and that type of condition. It can tell you roughly how long you would expect that implant to last for. So it might say 17 and a half years. It can tell you your percentage of complication rate and why that implant may wear out. And so we're just seeing the beginning of the technology, but as we collect more data over so many more conditions, we're going to be able to explain to our patients in so much more detail and give them personalized advice for their conditions. And I think that's so important.
Lovely.
Can I say one more thing? The other thing is these models, they learn. The more people who use them, the faster they learn. I've noticed this LLM, MED42, it's getting smarter. It's like I've got a young doctor, and she's getting really, really smart, and she's going to overtake me soon. You know, that's how it feels. So I really encourage everybody here to use this. It's really, really useful. It gives you more time, and the more you use it, the better it becomes, and the better it is for me. So I encourage you all to start trialing this, be on the team, because it's amazing watching it develop. It's really, really exciting.
And every time we challenge Maz, I say, Maz, can it do this? He goes, yes. And he just produces. So if you've got any ideas, just ask Maz. He can do anything.
Thank you. That's a lot of responsibility.
There was one question, actually. One of the delegates asked me a question, which the lady was very concerned that MED42 can replace doctors, and she doesn't feel safe to hand herself to an AI. I mean, the answer, I've been asked this many, many, many times. I mean, we have to remember these AIs are here to complement and support decision making. Ultimately, you will not give yourself or have an operation by a robot. Even robotic orthopedic will be managed by a consultant. And I remember my daughter, she asked me the other day, she's thinking about her future job, and she was worried AI will not leave anything, because AI can write novel, can design architect, can do everything. But the one thing that AI will not take over is medicine, because no matter how many gadgets and toys and softwares, there'll be always a responsible physician to take the ultimate decision. And I think we should not be concerned about AI. And actually, we should support and encourage the use of AI in our practice. And I think it is the way there to stay for as long as it can.
Thank you, Dr. Ladd. Those are very amazing closing statements from all our experts. But before we end, I have a doctor joke on this one. I always keep saying, so I have to go back to being a doctor, not waste 12 years of training. So I always say, we built MED42. We had a large language model that understood English. We went to college, we trained it, we went to med school. And now it understands medicine, it understands life sciences. We've now placed that medical graduate into the hands of these experts, where it's undergoing residency and getting the skills from them. So thank you so much for your time. Thank you so much for investing your effort in this one. Thank you.
Thank you.
I think...
And thank you so much, Dr. Maz. I know you said you might return to being a doctor, but we're going to ask you to return to this stage for the next session. May I ask our panelists to please stand for a photograph? Thank you. Another big round of applause, and we're back in 2 minutes' time. Thank you so much.